Good morning. I'm Eileen Doherty, Executive Director of the Colorado Gerontological Society. As the director of the society, a nonprofit organization, older adults often tell us they didn't know about many programs, services, and benefits for which they are eligible. One of our main goals with Senior Answers, in partnership with Legends Radio, is to share information and help you take advantage of these programs. Today we're going to talk about help with paying for prescription drugs through the Low-Income Subsidy Program, or Extra Help as it is sometimes called. Many Medicare beneficiaries are eligible for the LIS program and do not know it. Depending on the Medicare Part D plan that you have and whether you are in a standalone prescription drug plan or a Medicare Advantage plan will depend on the cost of your premiums and copays. Our understanding is that hundreds of Coloradans could and or need help to pay for prescription drugs. While Social Security and Medicare have done some outreach to let Medicare beneficiaries know about this financial help, our goal is to advance the work and help more older adults who are struggling to pay for prescription drugs. So we've reached out this morning to the Social Security Administration, which administers this program. We have with us today Josh Weller, who is the Public Affairs Officer for the Social Security Administration. He is going to share with us what the program is, the different parts of the program, and how to apply. Welcome, Josh.
Thank you for having me.
So let's go ahead and get started, and let's learn more about financial assistance and help to pay for prescription drugs. So what is the low-income subsidy?
The Medicare Part D low-income subsidy, otherwise known as Medicare Part D Extra Help program, helps Medicare beneficiaries with limited income and resources pay for prescription drug coverage. Eligible beneficiaries receive subsidized premiums, deductibles, and copayments.
And so how does somebody go about qualifying for that program?
To qualify for the Medicare Part D low-income subsidy, you must have Medicare Part A and or Medicare Part B and live in one of the 50 states or the District of Columbia and have limited income and resources below certain limits. Now, certain beneficiaries are automatically deemed subsidy eligible. These beneficiaries have Medicare Parts A or B or both and are already entitled to supplemental security income, eligible for full Medicaid coverage or covered under one of the Medicare savings plans. Beneficiaries who qualify as deemed subsidy eligible will receive a letter in the mail with more information.
So the names of those programs, you might know them as SSI, or you might know them as Home and Community-Based Services, or you might know them as one of the MSP programs, or you might also be in a nursing home. So sometimes the alphabet soup we get a little more confused about, but then that's how we know what we're eligible for. So tell us, how much money can a person make to be eligible if they are not deemed eligible?
Sure. So a beneficiary must have countable income less than 150% of the federal poverty level. The amount someone can earn each year depends on their household size. So, for example, if there's one person in the household, the yearly income limit for 2025 is $23,475, or that's on average monthly income of $1,956.25. And if there are two people in the household, the yearly income limit for 2025 is a little bit higher. It's $31,725, or on average, their monthly income would be $2,643.75. The income limits increase with the larger household size.
So sometimes we think about these programs and it's even labeled the low-income subsidy program. But what we're really looking at is people who have almost $2,000 of monthly income, which many people do not think of themselves as low income. So this is really helpful for, or should be for, a lot of households. How about assets? how much money can people have in savings?
So in 2025, an individual's resources, otherwise known as an asset, the limit is set for an individual at $16,100, while married couples have a resource limit in 2025 of $32,130. Resources include things such as money in a checking, savings, or retirement account, could be stocks or bonds. If an individual has rental property or a second residence other than which they live, or land, life insurance policies with cash surrender value could be seen as a resource, other personal property, and vehicles. Now, some resources we are able to exclude from your eligibility. So the home in which you live, one vehicle if you have burial plots, up to $1,500 for burial expenses if you put that money aside, furniture and other household and personal items. And these limits can change from year to year. Even if you don't qualify for extra help now, you can reapply for extra help anytime, as long as your income and resources meet these limits.
So again, while we tend to think of people as relatively low income, there's still quite a bit of money that you could be, that you could have in like a savings account or whatever. And I think the thing that we hear at our office most often is, well, what about my house? Because people really do not want to jeopardize their house. And as long as you only have your house and one car, those are not counted. So again, a lot of people are hesitant to apply, but if you have those income limits and those asset requirements, and all you own is your house and your car, why you should consider applying. So Josh, can you tell us how to apply?
Sure. So applying for extra help is easy. Just complete the application for extra help with Medicare prescription drug plan costs. You can apply online at ssa.gov/Medicare/part-d-extra.help. Or you can call Social Security at 1-800-772-1213 to schedule an appointment to file over the phone or in person with your local Social Security office. And after you apply, Social Security will review your application and let you know if you're eligible for that Medicare Part D extra help. And if so, you can choose a Medicare prescription drug plan. Now, if you don't select a plan, the Centers for Medicare and Medicaid Services will do this for you. The sooner you join a plan, the sooner you begin receiving those benefits.
So what if, what kinds of documents or what kind of proof do you need when I'm applying?
Sure. So we'll do an interview by phone. It's the same application if you were to file online. There's not necessarily proofs that are involved at the initial application level, but when you complete that application, there may be some proofs that are requested from the field office to verify some of the income and resource limits, and that's on a case-by-case basis.
So that's even easier because many times we think of when we apply for government benefit programs, we have to have all of this information. And what Josh is sharing is that we really don't for this particular program. So the next thing that we need to sort out is some people have already signed up and they already have a Medicare Part D plan, or they have a Medicare Advantage plan. So what if I'm already enrolled and I just learned about the fact that I might be eligible? What do I do now?
Sure. So if you're already enrolled, I'm sorry, are you asking?
So I didn't know about the LIS program. So somebody just told me that I had to have Medicare Part D or I'm in a Medicare Advantage plan. I didn't know anything about LIS, but now I've learned about it because you have shared with us the eligibility. What do I do now? If you already are enrolled in Medicare Part D, you're 75 years old, you realize now based on this phone or on this radio interview that you might be eligible for help through LIS. What shall you do? And basically the answer is follow the same protocol. So you call Social Security or you go online, and even if you're already enrolled in a Medicare Advantage plan or a Medicare Part D plan, you can still go ahead and apply for this. You don't have to just be eligible when you're first eligible for Medicare Part D. So one of the things that we learned a couple months ago is that some people had LIS and they were dropped from the program for various reasons. And so they find themselves having to pay full price now for their prescription drugs. If you are one of those individuals who had the LIS or Extra Help, and now you think that you're not getting it, what should those individuals do?
So if an individual is currently paying full price for prescriptions and previously had Medicare Part D low-income subsidy, they would fall under one of the following. They used to be a deemed eligible individual who maybe recently lost their Medicaid entitlement and need to simply reapply for low-income subsidy, or they had a subsidy change event that increased their household income or resources and should check in with Social Security. Another issue we're seeing is that people, when they change their plan, the plan itself is not reflecting their low-income subsidy. This just involves a phone call to Medicare, and Medicare resolves the issue with the plan, or the plan can resolve the issue on their end with Medicare.
So the takeaway here is if you've applied and you think you're not getting it, then don't just sit around and wait, but rather take action by calling Social Security, calling Medicare, or calling your prescription drug plan or your Medicare Advantage plan. I think sometimes people are reluctant, if you will, to make those phone calls. Is there anything else that you would like our listeners to know?
Sure, I would encourage listeners who are interested in learning more about the Medicare Part D low-income subsidy, also known as the Medicare Part D Extra Help, to visit Social Security's website at ssa.gov/extra help, or you can call Social Security at 1-800-772-1213 if you have questions about the Extra Help program or need help filling out the application. Or you can also visit Medicare's website at medicare.gov/extra help, or call 1-800-633-4227 to learn more about Medicare drug plans, Extra Help, and other ways to lower your prescription drug costs.
So that brings us to a close this morning. Thank you very much. All of those telephone numbers should be very helpful. If you still have questions, you can always call our office at the Colorado Gerontological Society at 303-333-3482. And again, Josh, thank you for the great information that you have provided to our listeners this morning. And a big thank you to Legends Radio for bringing this public affairs program to you.